Hello, everyone. Good morning, good afternoon, depending on where you might be joining us from today. I'm so excited for today's webinar. I have Jose on the line with DashboardMD, and we're going to be talking about strategies for effective healthcare performance management. My name is Caitlin Hausman. I'll be the organizer for today's webinar. Like I said, Jose is going to be presenting some really great information, just really focused on how to manage different types of performance metrics, what benchmarking looks like. So we can't wait to hear from him. Before we get started, a few housekeeping items. We are recording this presentation, so we'll have the recording sent out to everyone that registered later today. And then we'll also include a copy of the slide deck. And then, of course, in your right panel, if you have a question throughout the presentation, go ahead and type that in the chat panel, and we'll save some time at the end to answer any of the questions that come up during today's presentation. But I think that's all I really had. So Jose, I'm going to hand it over to you so that we can get started.
All right, thank you, Caitlin. I just want to make sure I do a quick sound check. Am I coming in okay?
Yep, sounds great.
Great. All right, let's go. All right, well, hello, everyone. Just a quick background here, a little bit about me and our agenda today. I'm a senior executive analyst. I'm a business analyst. I work with data. I work with practices of all shapes and sizes. I'm happy to present today. I've got a lot of good information to cover. And I'm hoping that the topics that we discuss really get you guys thinking about tracking goals, thinking about performance. How are you measuring performance? What can you do to improve? And really start that conversation. There's a lot of moving parts. Lord knows it's not easy to manage a medical practice or a medical back office for that matter. A lot of complicated stuff. And hopefully we'll help you guys sort of formalize a better process for managing all of these moving parts. So as you may know, we're going to cover performance improvement. That's really our goal, to talk about a formal way to manage a performance improvement initiative. And I'm going to break that down for you. Some of the stuff might be a little obvious, but there's a lot here that probably isn't. And there's a nice formal way to sort of keep your sanity and get through this, and then even improve on the plan itself. Okay, and at the back end of this, we're certainly going to, we've got a little time to answer questions. I'm going to try to go a little quickly through some of these areas, and I'm going to spend as much time as we can in an actual application showing you dashboards and showing you actual reports that target performance, performance metrics and goals, and show you how it works, show it to you, show you the real deal. And let's start with a little bit about our background. So DashboardMD, we've been doing this for 14 years, which is amazing. We only focus on healthcare, particularly in the ambulatory model. We do work with some hospitals as well, mostly hospitals that are managing practices, multi-specialty groups, and the like. And in a nutshell, we're an enterprise data warehousing and advanced reporting solution. In English, we basically plug into the raw transaction data, and we provide you with a much more formal reporting layer that focuses on performance. It's much more of an executive reporting layer. So it's not, we're not expected to replace every report you deal with, but certainly to give you a set of reports that are focused on performance. And I'll try to give you some examples of how we do that. But most importantly, I'm going to stick to the performance plan and really cover a lot of ground. We're going to talk about KPIs and a lot of good stuff. Now, as I mentioned, we work with practices of all shapes and sizes, and I mean that literally, from very large academic facilities pushing out over 1,000 provider productivity reports per month automated, to single docs and small groups and everything in between. And so we've got a pretty good sense of some of the challenges that are out there. And what I find interesting is that there is a common challenge, right? Whether you're dealing with a large multi-specialty group with lots of moving parts, maybe even multiple systems, we can certainly roll that up, or you're talking about a single doc group with a couple of mid-levels and dealing with their challenges. The inability to pull this, what I would call performance and analytic information straight out of any PM EMR. We map to over 30 different all the big names, practice management EMR systems. And they're just not designed as a data warehouse is. That's where we come in. We grab all that raw data, we pre-calculate a ton of stuff to make it available. So that's sort of the technical background. Now you know where we sort of come from. And let's get to managing and talking a little bit about how to approach this. Well, the first thing I wanted to reiterate, if you didn't catch it in our intro slide, was this statement: you can't manage what you don't measure. And boy, does that say a lot. And it's so true. You really can't manage the complexities of these practices with grand totals and subtotals of visits and gross charges and collections. There's just so much more going on. And what we're hoping to do is sort of give you some insight into ways to try to, take bite-sized pieces and create a more formal performance management track. And then when you talk about performance management, I couldn't help but put up this slide and talk about the Hawthorne Effect. For those of you that are familiar with it, bear with me. I'm going to give a very short version of this story to the folks that might not have heard about this. But it is not only a performance management sort of phenomenon. It's sort of a psychological phenomenon. And in English, what they're stating is that if you're tracking and you're measuring performance, and the resource knows that they're being measured, performance improves. And so what happened here was this company called Hawthorne Works in the 30s, outside of Chicago. This company built telephone equipment, and they started experimenting with lighting. They thought to themselves, well, maybe if I change the lights, I make them brighter, it would improve performance. They were looking for things like that. What they did do that really set this apart was they started to, have people document and track, the assembly line. And imagine guys with clipboards and stopwatches tracking every step of the workers. Well, what they found after about 6 months of just documenting their baseline, as we call it, they found that performance was steadily improving, and they hadn't changed a thing. So they were baffled at first, and in the end, what they figured out was that the mere fact that they were, managing or measuring the performance, and everybody knew about it, well, the workers naturally tightened up, and they worked harder, right? So if you've got someone looking over your shoulder, if you got your boss staring at you all day long, other than being annoyed and stressed out, you're going to probably really put the pedal to the metal and crank it out. So it's a great concept. And with that in mind, I want you to keep that in the back of your mind as we go through this, because one of the most important things I want to stress, if you walk away with at least one thing from this presentation, I want you to consider the idea that you're going to communicate performance is important throughout your team, whether it's the performance of scheduling analytics, looking at dropping no-show rates or increasing new patient activity. We'll talk about that as a good example. The mere fact that you're making it important, that you're discussing it with your team, and that you're showing them how they're doing will drive improvement, okay? So let's dive in. So I wanted to really start by breaking down a performance improvement framework. And in English, that's just it's just a plan and a series of steps that you can formally put together that'll help you stay on point. And the first thing you want to do is start with a plan. And to us, a plan is really to define what you want to improve. You got to state what you're going to do, right? Then you want to make sure you can measure the improvement results, and that also includes a baseline. We got to know where we are, so we know where we're going, and then we know how and measure throughout as we get there. Monitor. You got to keep an eye on the ball. It's not important to just have a plan. We measured it. We know where we are. We sort of discuss what we're going to change, and 3 months later we go back and nothing changed. You got to keep an eye on the ball. You got to keep that communication going, and shed light in areas that are not performing as expected. And last but not least, well, I shouldn't say last, but almost last, you got to analyze. As you're going through this, you may learn different scenarios that you didn't consider when you were making your plan. And so this will help you fine tune that plan. And it really is an ongoing process. You got to repeat, and you will improve, and it will get easier. The first time around is always the hardest because you've got to sit down and think through everything. But as you do this repeat process, you're going to improve even to the point where you're improving your plan, and you're probably going to improve how you measure it. You're going to target your measurements a little bit better. And I'll try to walk through that in more detail. Let's take a dive into each one of these, and then we'll go into the application and look at some examples. Let's start with the plan. So as I said, you know, we really want to define a clear plan. We want to think it through and identify a couple of key things with the plan. You know, the first thing we're going to do is identify some action items. You know, if we wanted to improve new patient activity, we want to see more new patients, and I pick on that because it's relatively easy. You know, primary care type practices maybe see 5%. 6% new patient activity. Specialties may see as high as 30%. 1 in 3 patients they see as a new patient. Hopefully, you know, it's a great metric. It helps practice growth. It's a very healthy metric. So let's just kind of run with that for a little while, at least to just kind of have something. But there are lots of metrics you can consider, and the idea is to clearly define how you're going to improve those. And you got to identify stakeholders and also resources. And there's a slight difference. I'm going to use the word stakeholders as a catch-all, just folks that are involved in the process that have an interest in seeing this improvement through. And it could be as simple as providers seeing their new patient activities improve, or it could be a little more complex where you might have a compensation model that incentivizes the providers to see more new patients. And if we take a little deeper dive into those, let's just kind of walk through the kinds of things that you're going to be wrestling with. So assuming we want to increase new patient volumes through the practice, well, all sorts of questions come up. You sit around a table and just dive into that. You're going to be amazed. Can we see more new patients, first of all? Are we too busy that we can't even afford to see more new patients? That's a possibility. It's a good problem for sure, but you know, it kind of leads to some other conversations about, hey, can we streamline this a little bit? Why are we so busy? So you can see how these things sort of open the doors. And so I always say, ask a lot of questions. Which physicians are seeing the most new patients? So you might find that some physicians are seeing a lot of new patients and others not so much. So now you've divided this by physician. You're saying, well, why are these physicians seeing more new patients than the others? So there's a comparison analysis you might consider. Let's compare new patient activity across our docs. Simple enough. And if we find a significant discrepancy, let's dive into it. Again, more questions, but this is the process. You're already you're working towards improvement. So remember that. Where are most of the new patients coming from? Well, you know, is it referral sites? Can we take a look at the referral sites? Let's compare them this year to last year, the last 6 months to the prior 6 months. Is it really maybe a a payer mix shift that caused my new patients to slow down? You know, I was getting a lot of new patients from this payer, but all of a sudden I see it slowed down. The point is to start to identify what's going to affect this improvement, right? And we could go through a bunch of them. E&M coding levels. What should we expect in terms of our new patients percentage? How are we doing? If we see 5% of our patients as new patients, that's pretty good. If we're a primary care, if we're a specialty group, a GI group, an ortho group, cardio group, what have you, that's not so good. That's very low. So you got to put things in context, right? So keep in mind specialty matters, right? And your particular practice matters. And you're going to see, we're going to talk about what we call internal and external benchmarking that will help you with that. So there are ways to address these questions as well. Of course, you can look at appointments, how that's affecting. And lastly, you can look at your recent activity and compare your activity to prior activity. So you might look at this month versus last month. It's simple enough. Maybe this year versus last year, and you know, use your trends as a comparative. And when you go to the point where you're sort of pinning down your action items once you've got a better picture of how you can improve or where you can improve to see new patients volumes increase. Uh, you might identify those specifically all the way through to process improvement. That means this person here is going to do this, this, and that from now on to see if we improve. And it might include things like, let's improve our scheduling templates. Maybe you find that the docs are always pushing off new patients for Fridays or something, or you have one doctor doing that and you didn't know about that. Well, let's address that. Maybe they push off new patients out 3 or 4 weeks, and you got a lot of no-shows for that. New patients want to see the doctors right away. Perhaps we make some process uh, modifications accordingly. So you'll think through these things, and you want to do some things that are tangible and measurable, right? And it may involve marketing. You may even look at engaging the community. And as I put here at the end, after thinking about this sort of briefly, maybe it's all of the above. Maybe we can help. We can improve by doing all of the above. Some of this stuff is relatively easy to implement, and maybe you could start there. Maybe start with the low-hanging fruit. But the point is to have a very clear sort of plan of what you're going to accomplish. So far so good. We've talked through what we want to accomplish. We've analyzed it a little bit in different ways. We've come up with a couple of action items, I'll call them, where we're going to focus on. Now we need to identify stakeholders and resources, folks that are going to help us improve. So I threw on a list of pretty much the typical sort of roles in a practice. I might have left out a few, like the clinical quality manager and stuff, but let's just go through these. So the office manager or the site administrator, they're certainly engaged in seeing more new patients. That's going to help the bottom line. It's going to help the health of the practice. Physicians and mid-levels, of course, yeah, we might even incentivize them to do that. Certainly we can set a goal and say, hey, you've been seeing 10 new patients a month or 5 new patients a month. We want you to at least continue that. Front office and scheduling personnel, maybe it makes no difference to them, but if they're incentivized and they know that they want to have a certain number of new patients fit into a month, they may push to get the patients in. Back office personnel, I don't know. I don't know if back office personnel has an incentive to see more new patients, right? So I did that on purpose. I just wanted you to consider who might be a stakeholder and a resource that will help accomplish the performance improvements or will help drive performance improvements. And executive and board members, I don't know how much they'll do, but they certainly would like the reports knowing that new patient is growing. That adds value to the practice, of course. It's healthy for the practice, and as executives would say, it increases shareholder wealth, right? So my point is really for you to consider who needs to be involved to really be successful, okay? And the first thing that the next thing that comes to mind, once you identify the resources and stakeholders, what information are you going to feed them and how often? And that comes in with measurement. All right, let's talk about measurement. Remember, you can't manage what you don't measure. So this piece is a very big part of it. And in some ways, this is where the IT and reporting challenge really sets in, right? So now you got a great plan, you've already implemented some changes, and now we need to track that stuff. Well, I'll tell you right now, if you don't have a formal business intelligence or reporting platform and the tools involved, you can do some simple things and identify some very simple key performance indicators and just keep an eye on those. You don't have to stare at 30 metrics relating to patient volumes to see improvement and to track improvement. Maybe the one key performance indicator is I want to count new patients per month per physician. Okay, so those are two measures. You want to total it up for the month for the practice, and you want to total it individually per physician. Now, again, this could extrapolate. Maybe you look at new patients by your top payers, by financial class or payer grouping. That might be another set of measures. Think about each one of those, can have their own goals and benchmarks. So that way we're tracking if the payer mix is affecting new patients. We're also tracking if the physicians themselves and their schedule are affecting new patients. And the end roll-up result is, well, we're counting new patient activity and we're looking at it every month. Well, maybe we want to look at it weekly to get a little bit of a sort of a shorter leash on it, a little tighter leash, as we say. So those are all things to consider. But I would say to you, in a simple sense, start somewhere, okay? And just being able to measure it once a month, separate it out into a report that you can share with the stakeholders, that will be a great step in the right direction. And over time, as you sort of smooth out generating that report and having that piece of information, you may add more measures. You may even extrapolate that same measure different ways, as we just discussed. You know, like maybe breaking it out by payer. If you have multiple locations, certainly you break it out by multiple locations, and so on. So we're going to talk about KPIs. I'm going to take a little deeper dive in just a second there, and I want to talk about some key performance indicators that are very helpful and a little bit off the beaten path. You also need to baseline, measure your starting point. So we want to improve. Well, let's start somewhere. We have to start somewhere. How are we doing right now? What is our average for the last 6 months? What's a reasonable expectation, right? So setting some random unattainable goal may not be the best idea. You know, having everybody be underperforming constantly is not good for morale. So I guess what I'm saying is just putting your goals way up high isn't going to magically get you there. The trick is to set your goals just above where you've been averaging to strive to improve. And the first step is to get all of those trends headed in the right direction. If you look back for the last 6 months, and I know this is a tough year, this year's been tough on everyone, but we've had a bit of a bounce back, and healthcare is very resilient because, you know, folks got to see the doctor. It just gets pent up. You can postpone a hip replacement. You can postpone a stent. Well, maybe not a stent. I'm trying to think of simple surgeries that are quote elective surgeries, but they're not so elective. You got to have them. So I can see it already in the numbers. We're about 90% back to where we were. At the very beginning of the year, as we turned the year, we were really a lot of everything was firing on all cylinders, right? So not to get off track, you know, it's good to have a baseline. Look at your recent activity and just continue to improve your trends. Make sure they're headed in the right directions. And then you've got benchmark data. I'm going to spend a good quality amount of time on that. So benchmarking data is basically a way for you to compare yourselves, meaning your practice, to an external source. And a really good source is MGMA, where we're avid members. They provide yearly benchmarks, and they do a really good job. They're very well known for that. And there's lots of ways to slice and dice it. So there's a ton of stuff you can learn from their products, and we're happy to work closely with them. We also have a benchmarking tool that will help sort of get a little more granular, because this tool can show you how you're comparing to other docs that we manage. It's all de-identified, of course. In fact, it's more than that. It's all just calculation. So there's nothing behind it other than results. But it's a great way to compare how you're doing to the rest of the world. But you got to stay within reason. You got to stay within the same specialty. You can even compare by state. Maybe you can look at the size of your practice. So those things get you to a more comparable ballpark, but much more reasonable. So we're going to dive into those a little bit. And with that, I'll take you into the application. We'll have a little fun, look at some screens. So let's start with key performance indicators, KPIs. So, you know, you're probably looking at KPIs all the time with your reports as it is. If you look at gross charges and you look at total collections and you look at adjustments and you carve out adjustments by non-contractual versus contractual adjustments, those are KPIs. Those are very important metrics. And you're looking at your totals, and maybe you're comparing them to the same time last year. Maybe you're looking at AR days. That's a little more complicated. There's a difference between days in AR and days to pay. Days in AR is an interesting measure. It gives you a sense of what amount of AR should I be managing? What's reasonable? And what's nice about the measure is that it works for any size practice. So if you've got a practice that bills out about $1 million in gross charges per month, then your AR should be about $1 million. That puts your days in AR at about 30 or 31. And if you've got a practice that bills out 100,000 a month, your AR should be about 100,000. That gives you a days in AR of about 30, 31. So that's really the magic of that measure. It's very interesting. And days in AR might vary between different payers, but for the most part, it tells you how much AR is reasonable to manage and maintain, and it should be within a month or 2 months of your billing totals. Anything extended from that, you've got a lot of AR there you need to work down or write off or what have you. Days to pay actually measures how many days it's taking from your first bill date to your first pay date, your primary pay date. So that's interesting because that one actually is counting days. And you'll see that that varies significantly from payer to payer. So some payers obviously are much better, much faster, and you probably know all those. And other payers, you got to dig in a little bit more. So there are those kinds of metrics that can give you a lot more insight. And that's what I was really referring to. So start with the measures that you have. And if you want to get a little bit more insight, you'll dig into other measures. And real quick, you've got measures that focus on scheduling. You've got arrive count, cancellation count, no shows, third next available appointment gives you a sense of accessibility. The productivity measures are pretty straightforward. You've got your visit counts, you've got new patients. Percentage of new patients is a great one. So that's a little bit different. You take your new patients and divide them by your total patients seen. That gives you a percentage, a ratio. Average visits per day worked. That one's a little more complicated. That says for the physician, the days they work, this is the average visits they see. And that one's nice because it doesn't take a dive when they take vacation. Work RVUs is excellent. There's so much you can do with work RVUs. If you're not using RVUs, it's probably because you're afraid of calculating them and all the work that goes in there. And we understand that, but they're fantastic way. They're a fantastic way to cut through the fog of when you compare things, comparing apples to apples. I'll give you a very simple primer. So work RVUs is the number of work units for each CPT code out there. And CMS took the time to come up with all that. They updated actually quarterly. And so that you know how many work units, relative work units per CPT code. So a level 3 visit might be 1.0. Don't hold me to that. But let's say it's 1.0. So if a level 3 is 1.0, then a level 4 is 1.1 and a level 5 might be 1.3. So it has a little bit more work unit when you do a level 5 visit, and a level 1 visit might be a 0.5. So with that, every CPT code has been coded to give you a relative value work unit. And you could do all sorts of cool things. You could calculate your total RVUs for the year and then get your total payments for the year and find out your average payment per work unit. Isn't that a great measure to have in your back pocket? Or what about your cost, your total cost for the year? Now, just when you do that, little caveat, for work RVUs, make sure you only include physician payments and physician salary and bonus, but you could take your total cost per physician, physician bonus, physician payment, and divide it by your total work RVUs for that physician or that group of docs, and you will get a cost per work unit. And you'll know how many dollars you're getting paid for every unit of work versus what it's costing you for every unit of work. Great stuff, honestly, and it doesn't take long to get it once you have your totals. But anyway, let's keep trucking. Collections, a lot of good metrics there. You can track things like point of service collections, average payments per visit, average payment per work RVU we talked about. And then there's the whole clinical side for the primary care type models using value-based care. We are a CMS registry, so we track all these quality measures and all the different payer programs like HEDIS or CPC First or CPC Plus, patient-centered medical home, all that good stuff. And they basically whittle it down to these quality measures that are ratios based on, well, there's a few what we call outcome measures that even like A1C port control, but a lot of them are based on sort of procedures and like, cancer screenings and the like. Anyway, hopefully that gives you a little sense of the indicators. Now let's talk about how you use external and internal benchmarks to assign a goal. So once you identify your indicator, and I think we all agreed that new patient count is going to be our KPI, right? So we might want to analyze here. Let me zoom in here. I learned how to do this recently, so I'll take advantage of it. Let's go right in there. So this is a primary care, and they're not seeing a lot of new patients, but they're seeing some. And you could see that they have room for more. This pink line is CMS. So according to CMS, we have room to see more new patients. I guess this was this screenshot was from a specialty group, but regardless. So the point is that there's room for them to see more new patients. So that's good news. So if I scroll down and they compare their established patient visit, you could see how they're doing versus Medicare, and the green line is this is one doctor versus the group. So this doctor's coding a lot of level 4s, a little bit more so than level 3s. And so these are ways for you to identify what the ballpark should be for a doctor or for a or for the practice, a set of doctors under a specialty. This example shows you a benchmark. So this is comparing providers to the external list of providers. So think of it this way. This is saying, how's this provider performing versus, a couple hundred other docs. In fact, this is probably a good time. Let me go ahead and let's have some fun here, and I'll log into the application. This is just real quick, this is a web-based solution. It's hosted. I'm logging in using Google Chrome. It is a secure site. Of course, you're using a training account. It's fully de-identified, and all the names have been changed, but it is real data. And we'll give it a second here. Okay. When you first log in, you get this main menu, and you've got this home page with some favorite dashboards and the like. And I'm going to run a few of those, but I'm going to start by going over here to dashboards, and I want to run the benchmarks dashboard. And let's look at these orthopedic surgeon analysis I did in preparation. So what I did here was I selected orthopedic surgeons, and I wanted to know the new patient activity, and it found 328 orthopedic surgeons. Now, just so you see, over here on the left, you've got all sorts of cool filtering. I picked new patients, but you could pick other measures. Even RVUs, or average payment per work RVU, so you can compare those to the external set of doctors. You can pick the percentiles. I happen to pick 50th and 75th because that's what this doctor matched with. You can pick a specialty, full-time status, provider type. I picked the doc, and you can certainly pick things like state, maybe group type or group size, practice size. So you can go and pick different sizes and hone it in a little bit more. So basically what I did here was compare this doctor's new patient visit over the last 12 months. And you can see that he dropped off the shelf here. Actually, why don't we go back here and we'll rerun this. And it only takes a second. We'll rerun this back through, let's run it back through July. So I had some good data through July. So we'll just pretend it's July, and that's what we're analyzing. So what I'm doing is comparing this doctor's activity to the 50th percentile, which is the yellow. And you can see that the doctor was crushing the 50th percentile here per month, had a little bit of drop in January. Maybe he was out of the office, understand, but he picked it right back up and stayed well in the pocket. And over here, this piece compares a time range. So I could say, well, let's look at from January through July, the first 6 months, the doctor saw 242 new patients. And actually the 50th percentile was 259. So just under the 50th percentile for this year to date. If I went back and maybe did the prior 6 months or something like that, let's see how he fared. And indeed, and we saw here that he was crushing it. This doctor saw 412 new patients compared to the 50th percentile, which was only 329 for those 12 months. So this is the type of tool that'll give you the ability to really pin down uh, a goal, your goals and benchmarks. But again, if you don't have something like this, or you don't have MGMA, which will give you some insight, it's okay to go back and have a comparative internally, right? Let's look at the last 6 months. Let's look at this year's average per month. Just make sure you have a comparative. Don't pick a number out of a hat, and don't try to compete with another practice that's bragging about seeing, 400 new patients a month. Who knows if that's accurate, right? So with that in mind, let me show you. Well, actually, I'll come back to that because that is the next section. If I could find that. Okay. So we talked about measuring and tracking these results. The first thing you do is get a baseline. You get a sense for where you are. You define where you want to go by looking at goals, both external and internal comparatives. Now we've got a sense of where we're going. So I love Yogi Berra quotes, so I wanted to throw a couple in there. You can observe a lot just by watching. Again, tying it back to what we're doing here, one of the things I want to stress is to make sure you communicate that this is important, there is a goal, we're tracking it, and you communicate performance. You're going to see improvement, okay? So let's talk about monitoring, and that is the next big step. Now that we've measured it, now that we've set goals, well, we got to keep an eye on the ball, as I say, okay? We've got to compare those KPI results on a regular basis. That could be monthly, but maybe weekly if we have the means, especially if you're keeping it on a tight leash. Maybe no-shows you want to compare weekly. New patient visits monthly is probably better, but it doesn't hurt to do a snapshot in the middle of the month and see how we're doing. And that's the idea, is to keep it current and communicate those results with the stakeholders. That's key. You got to have that communication. All right, so here's an example of a monitoring tool. This is an executive scorecard, and I'm going to show you this in action in just a second. And what this does is it gives you the ability to see at a high level which measures. You got a bunch of KPIs turned on here. Hey, let's zoom in. So you got a bunch of KPIs set up here. And if you take even gross charges that's selected here, our goal was 359,000 for the month, and we hit 379. So we're at 105% of our goal, and the trend is stable. So that that sort of uh, says to me, okay, that's working out. So I'm not going to focus on that right now. So I'm going to focus on these hot spots. My AR is high. My total adjustments is higher than expected. So this is going to prompt me to ask questions. So you can see how, when you look at a screen like this, how many initiatives I'm already tracking by looking at these key performance indicators. Here's that new patient percentage. So I'm right in that 5% mark for my new patients. So that one's working well. So that initiative is covered by this measure. Now I might look at this measure plus the count of new patients. So there's a couple ways to do it. It's like having pixels. The more pixels you have, the clearer the picture comes in. But again, I don't want to discourage you from having even one measure. Having 2 or 3 measures that are very accessible to you will help tremendously. And it's a great step in the right direction. So let's take a look at that in the application. Have a little fun with that. Here we go. So I'm gonna go to scorecards here, and I'm gonna run this simple scorecard. What's nice about this is that it's already sort of preset. So assuming that we identified which KPIs we want to turn on, in fact, I'll show you how we do that. We've got about 80 KPIs that you can enable. And we're going to stick with, let's stick with a productivity theme. So I'll say I want to look at E&M visits. I'll leave gross charges in there. I want to see new patient percentage, number of patients seen, number of new patients seen rather, and number of patients seen is unique head count, all visit counts. And let's work our way here to RVUs and visits per day worked. And I want to filter that by maybe by Oh, we said we'd do it by financial class. Actually, let's do it by rendering physician. I have a lot of docs. I have two different practices rolled up into here, so I got lots of good data. So let's take a look. So let's sort this by, here's number of patients seen, here's number of new patients seen. So if we take that, we're saying we want to see 301 new patients a month. Okay, our new patient percentage should be 10%. And we're actually at just under 8, we'll call it 8%. So we're not terrible, but that's pretty significant, right? So we want to see more new patients, and the trend is down. And so we've only seen 115 month to date. In the last 30 days, we look at a 30-day moving average. So we've seen 244 patients compared to our 301 per month. So that's why we're at 81%, and it looks like we're only projected to do 70%. So I need to take a little dive in here and take a closer look. So here I have a trend that's telling me that I'm trending down, and that does not bode well for our new patient improvement initiative. So this, obviously I would have known this as we were dropping down here, and I would have caught it a little sooner. But I did want you to see a visual representation of what we mean by your goals and benchmarks. And that gives you a better sense of what we're looking for. We're looking for a sweet spot, and we're looking for sort of a threshold that we don't want to cross. We want to improve from there. And what's nice about these interactive dashboards are really nice because I can quickly see who's doing well and who isn't. And I can sort it by variance to target. So I can see here's the doctor that usually does really well. So here are two docs that are well below where they should be. And in fact, I could look at some of my top docs, maybe look at my top 10. And here's that doc, Dr. Randall, that is well below. So that's the first person now I'm identifying and I'm driving into. Some of these other docs, like Dr. Power, has been doing great and has a very stable trend. So you can see that here. And this is what we would sort of want to see. Well, I guess he's a new doc, so he's sort of keeping that up. And there's lots of other analytics you can do, and I'll spare you all that. But the point is to quickly isolate a measure that may or may not be performing and be able to slice it a couple of ways, like maybe by doctor, like we talked about, maybe by financial class, if that's what we were targeting, perhaps even by location. All right, let's keep trucking here. We got some more ground to cover. This is a good example of a comprehensive provider performance report. Now, as I keep repeating, it's important to communicate results with the stakeholders. Well, this is a great way of doing it, providing them a report and sending it via email. This is a PDF report. We generate these automatically from reports you can generate in the system and push these reports out on a regular basis on some schedule, like maybe every first week of the month or something, every the 8th of the month, this report goes out there. Again, notice the power here, I'll zoom in once again. The power here is to highlight these areas that are underperforming. Your eye will not naturally go right there. Remember, we wanted 5% new patient activity. This doctor is only doing about 2.5%, something like that. So significantly below expectations. And that will prompt a conversation. Let's bring this down to earth. They're not going to snap their fingers and magically the patients show up, but they will push back. They'll say, why is this red? You know, I've seen new patients, and maybe we uncover a clerical issue. You know, hopefully it's something that can be fixed that easily, and then they were right. Or at least now the doctor is seeing that, darn it, I have to make time for these new patients and I have to really be aware of this. Same thing with access. This is your scheduling analytics, looking at cancellations. Maybe because of all these cancellations, it's affecting our new patient visits, because I've been canceling every Friday, and we've been setting up new patients on Friday. Clinical quality measures play a role. That's part of the revenue cycle these days. So you'll see that as well in this type of report. And so we call this a comprehensive performance scorecard. And it's just a nice way to keep them abreast. And then you've got something like this, which is your E&M visits, looking at new patient activity there as well and comparing it to CMS in pink, as we talked about. Now, this isn't a report you'll send out every month unless you're working hard to improve that, but certainly quarterly, you might do that. And then you have, here, I'll let it catch up with me. There we go. And then you have a way of communicating results, whether it's monthly, whether it's quarterly, or maybe even some, weekly flash reports, as we'll call them. Okay. So then we've got analyze. So now, we made a plan. We measured the baseline. We came up with some goals and some benchmarks that are reasonable. We've had a good talk with all the stakeholders. The docs know what's expected. Practice admins, everybody's on the same page. And now we have a way to monitor it. We have 2 or 3 reports that we're gonna stare at monthly, and we're gonna run them throughout the month every now and then and keep an eye on the ball. Now, based on those results, hopefully it'll start giving you some insights. You're asking deeper questions. There might be conversations that spark because of the lack of improvement, or you'll see a significant improvement in one and not in another. And these, again, will spark conversations and prompt you to investigate. And that's where this analyze phase comes in. Now you want to take and look back at these results and look back at what's happening and really dive in. And this is just a couple of screenshots of ways to address this new patient example that we adopted. So the first thing you'll do is maybe look at the new patient activity, recent activity, the most recent 6 months. Let's say we started this initiative 3 months ago. So we want to see how we've done for these 3 months versus the prior 3 months. And we might identify that a particular doctor, these are referring physicians. So this is interesting. I basically went back and said, well, we've had these great conversations with our referral sites, and Dr. Peters was always a top referral, but she's still short this year. But Dr. Willis, you see here, has been improving. She sent us 10 more patients, and Dr. Watts has sent us 64. So this is working, but these two, not so much. Maybe we still need to continue that conversation and see what we can do, and see how we can facilitate, maybe identify areas that they may not even know that we do. Maybe we have new doctors and so on. My point is that now I have a better sense of how my plan is working, in what areas where we are improving clearly, and what areas might require some more attention. That's the analyze phase. It's very important. You may even find a new way. You may find that, the payer mix isn't really affecting it so much. So I'm just going to focus in on these 2 areas. So it refocuses your efforts. And all of this taken together will improve new patient activity. And now, as you get out 6 months out, hopefully your trends have headed in the right direction. You've seen a significant improvement, and you've sort of adopted a methodology which you'll continue to improve even of itself. So this is just a kind of a fun one. I wanted to analyze new patients by age band. Perhaps we're not realizing, but we're seeing a lot of new patients in a particular age group or under a certain age, and we're used to seeing them at a different age. Or we saw a big drop in new patients, and it happened to be by a particular demographic, maybe a particular zip code, because a hospital came in or something like that. Other ways to look at it. Again, modifying your plan, honing it in to the point where you can focus your efforts on what's most impactful. All the while communicating with the stakeholders. I know I keep saying that. I did that on purpose. Without that, you're just it's sort of wishful thinking, right? You're imagining how great this is going to be, which we really need folks to be on board, and we really need them in the trenches, sort of making the difference. Okay. And then last but not least is repeat. You got to go back to the beginning. You got to build off of what you've learned. This is very, very important. I'm sure you've all experienced this as managers or being involved in different operational changes, where you've made these big changes and everybody leaves the meeting so excited, and you don't really talk about it much. And 3 months later, you realize nothing was really done. It floundered a little bit. Some people changed, some people didn't. And that happens all the time. It's human nature. We all just want to get back to the work we're doing. I see it personally with the folks that are really stuck on certain reports. And I'll ask them sometimes, tell me the last time you made a decision based on this report. And sometimes they just stare at me like, what do you mean? I'm like, yeah, well, you're looking at this report every month. What do you look for, and how does it drive your decision making? Do you make any decisions? They're stumped. They're looking at aging reports. They might look at some totals, and they don't really know what to make of it because there's no comparative data. They don't know the goal that they're looking for. So with that, let me wind it down. I'll leave you with another Yogi Berra quote. This is one of my favorites. If you don't know where you're going, you might wind up someplace else. Isn't that so true? So the idea, of course, is to think through areas that you can have an effect on, uh, pin it down to some measurements that you have access to that you can measure on a fairly regular basis, and set some goals. And there's different ways to look at those goals, but set something, even if it's just the same thing we did last month. Let's see how we do, and let's try to improve from there. And communicate. Communicate this throughout the team, and you should see improvements. Okay? So in a nutshell, if you need help with this stuff, we're happy to answer questions. I'm happy to get offline and work with you guys and share with you some of the stuff we've done in the past. Happy to help you with reports, even KPI formulas, all that good stuff. Let me know. Caitlin's a great resource. Any one of us is happy to dive in and help you guys out, okay? And if we could be further help to automate stuff, maybe get a data warehouse started, maybe you're wrestling with some of this, of course, let us know. We're happy to carve out some time and take a closer look and have what we call a demo discovery meeting where we'll learn a little bit more about your particular challenges and maybe try to hone in on a solution that is a better fit for you guys. All right, with that, I've got a little time left. I'm running a little late, but not too bad. I will turn it back over to Caitlin for any questions.
Yeah, thanks, Jose. I love what you said there about looking at reports, but are you making any decisions about them? I think that's so true. Great information. So we want to leave a few minutes. If you have any questions, go ahead and type those in your GoToWebinar panel, and we'll get to those now. I want to mention as well, there will be a survey that pops up when you exit the webinar, and then we'll also send that in the follow-up email. So if you have any feedback for us on today's webinar, we would love to hear from you. And you can also let us know if you want us to reach out to you with more information. If not, that's totally fine too. But one of the questions that did come in, Jose, is what kind of projections can you do for things like appointment productivity and revenue cycle productivity?
So good question. Those are great measurements. So from a projection standpoint, there's two ways to look at it. You have sort of a forecasting, which is built off of assumptions, right? We have to assume a couple of things. So there may be some logic involved with that. So generally what we do is we can run it in the ad hoc report and get all the raw data and then break it down by physician and the number of appointments. And then you can add some logic to it, perhaps like in Excel, for example. For projections, we basically take, I think I touched on that earlier, we take the averages per day, and assuming that you're going to continue that pace, we're going to project how the month is going to pan out. And with that view, coupled with your 30-day moving average, you get a pretty good sense of what's happening, where you're at relative to that goal, and projecting it forward. Now with appointments, Caitlin, there's an interesting little piece there. A lot of times you want to look at what's called utilization, right? Maximizing my utilization. I want to be full. I want to see as many appointments as we expect to see. But that depends on the practice. It depends on the provider. But what we do is we take some general numbers like 8 hours per day per provider. Even if they don't work 8 hours, that would be 100%, right? So then we measure the percentage of their actual booked appointments, and we project that out going forward. And what's cool about that is that your goal isn't 100% every day. Your goal might be to see how the last 3 months have been doing. Are they in the 80s? Did it drop from 80% down to 72%? that means, hey, something's going on. So it's also comparing within the trend. I hope I didn't get too far into the weeds, but maybe that helps.
Yeah, I think so. Another question is kind of around the implementation timeline, how long it might take to get started with something like this.
Yeah, so we usually say about 4 to 6 weeks from A to Z. We interface with a lot of different systems, certainly with all the versions of ECW, whether hosted or cloud-based or locally installed and so on. And we plug in, we pull all the raw data. We even pull the historical data so you can have, comparatives and trends right off the bat on day one. And then we get into training. We do a quality assurance test where we run some reports on both ends. But then we get into the training, and we include unlimited training, as you know. So it's very hands-on, and a typical implementation probably takes about 4 to 6 weeks.
Okay, perfect. Well, that's really all that I'm seeing on my end. Is there anything you want to add before we close out for the day?
Nope, I want to thank everybody for their time, though, for sure. And I hope that hope everyone on the call walks away with a couple of things to think about, and hopefully you'll consider setting some goals and having that communications, because I think you'll see the results even of that simple act, just setting goals, making sure everybody's on the same page. And I'll leave you with that. Thanks, everyone.
Definitely. Yes, thanks so much, Jose. We'll send the recording out today, and we hope everyone has a great rest of their day. Thanks so much.
All right, my pleasure. Bye, everyone.